STUD-ENT 4.31. Describe the clinical features, investigations, and principles of trauma to the face and neck by ENT student. Facial trauma. Facial trauma, also called maxillofacial trauma, is any physical trauma to the face. Facial trauma can involve soft tissue injuries such as burns, lacerations, and bruises, or fractures of the facial bones such as nasal fractures and fractures of the jaw, as well as trauma such as eye injuries. Illustration of the private injured in the American Civil War by a cell. Causes: car and motorcycle crashes, wounds, sports injuries, and violence. Clinical features: flattening of molar prominence, step deformity of infraorbital margin, anesthesia in the distribution of infraorbital nerve, trismus due to depression of zygoma on the underlying coronary process, oblique palpebral fissure, restricted ocular movements. Investigation: radiography, imaging of tissues using X-rays, is used to rule out facial fractures. Angiography, that is X-ray taken of the inside of blood vessels, can be used to locate the source of bleeding. However, the complex bones and tissues of the face can make it difficult to interpret plain X-rays. CT scanning is better for detecting fractures and examining soft tissue and is often needed to determine whether surgery is needed, but it is more expensive and difficult to obtain. CT scanning is usually considered to be more definitive and a better detecting injuries than X-rays. Radiology of facial trauma. At the beginning of the 20th century, Rene Lefort mapped typical locations for facial fractures. Lefort 1. Fractures: horizontal maxillary fractures, that is, involving the maxilla separating it from the palate. Lefort 2. Pyramidal fractures of the maxilla cross the nasal bones and the orbital rim. Lefort 3. Also called craniofacial dysfunction and transverse facial fractures cross the front of the maxilla and involve the lacrimal bone, the lamina papyracea, and the orbital floor, and often involve ethmoid bone, are the most serious. Lefort fractures. Management of the facial trauma. Measures to reduce facial trauma includes laws enforcing seatbelt use and public education to increase awareness about the importance of seatbelt and motorcycle helmets. Efforts to reduce drunk driving or other preventive measures. Information obtained from biomechanical studies can be used to design automobiles preventing facial injuries. Nectroma. It accounts for 5 to 10% of all the serious traumatic injuries. It is of two types. Blunt trauma may result in crushed larynx, tracheal disruption, expanding hematomas, and esophageal leak. Penetrating trauma may result in injury to major vascular structures, pharynx, larynx, trachea, and esophagus. Causes of neck trauma: hanging, that may be accidental or intentional, impact with a steering wheel, knife wound, gunshot wound, running or riding into stretched wire or cloths, fractured larynx, cervical spine injury. Zones of the neck. Clinical features of neck trauma: neck pain, restriction of neck movements, neck tenderness, varying degree of neurological deficits, complete cord syndrome, incomplete cord syndrome, that is central cord syndrome, Brown-Sequard syndrome. Investigations. Targeted investigations: midline, congenital or thyroglossal cyst, USS, thyroid, blood, thyroid function tests, autoantibodies, and calcium. Radiology, USS. Clinical pathway for emergency department management of neck trauma. The picture showing tracheostomy tube breathing. Management of neck trauma: use good posture, take frequent breaks. If you smoke, quiet, sleep in a good position, avoid tucking the phone between your ear and shoulder. Precautions to be taken at workplace. Thank you.